All right, so let's dive right in. Today we're going to be talking about how professional periodontal care can actually save money, both for you and your patients.
Yeah, that's right.
We have our expert here who's been looking at a 2022 article from the Swiss Dental Journal.
Mm-hmm.
The title is a mouthful. It's called Cost Savings in the Swiss Healthcare System Resulting from Professional Periodontal Care.
It is a mouthful.
But it has some really interesting findings.
Yeah, definitely some interesting stuff in there for sure.
So what really stood out to you from this research?
Well, I think one of the first things that really hit me was just how widespread of a problem periodontitis is.
Okay.
They mentioned that severe periodontitis is actually the sixth most common non-communicable disease globally.
Really?
Yeah, so we're talking 743 million people affected.
Wow, 743 million. That's a lot of people.
That's a huge number. It really puts it into perspective.
Yeah, for sure.
And I think the other thing that's concerning is that a lot of people don't fully understand the potential consequences.
Right.
This study highlights how periodontitis isn't just an oral health issue. It increases the risk of serious health problems like heart disease,
Oh, wow.
type 2 diabetes, even respiratory problems.
So it's not just about saving teeth, it's about, overall health.
Exactly. It's about saving lives, potentially.
Yep.
And so, that brings us to the financial side of things.
Okay.
The study focuses on the Swiss healthcare system.
Okay.
Because like many developed countries, they're dealing with these rising healthcare costs, right? And dental care makes up a significant portion of that, over 5% of total healthcare spending.
That's a big chunk.
It is a considerable amount. So, they wanted to see if investing in periodontal care could actually help bring those costs down.
Makes sense. Yeah. So how did they go about doing that?
Well, they used a computer simulation to estimate lifetime healthcare costs associated with different scenarios.
Okay.
So imagine like a virtual population aged 35 to 100, and you're tracking their health journeys over a lifetime.
Wow. An entire lifetime. So they're simulating entire lifetimes. That's pretty impressive.
It's a pretty sophisticated model they're using.
So how does that even work?
So they created 3 scenarios.
All right.
The first reflected the current situation in Switzerland. So, typical dental hygiene visits, the usual prevalence of periodontal disease.
Okay.
Scenario 2, they upped the ante on prevention. So more frequent hygiene appointments leading to fewer cases of gingivitis and periodontitis.
So more prevention, hopefully fewer problems later on.
Exactly. Now, the third scenario got really interesting because it built on that increased prevention, but it also factored in better public awareness.
Okay.
So people understanding the risks of periodontal disease and actually taking steps to prevent it.
Gotcha. So that's like education and prevention kind of all combined together.
Exactly. A more holistic approach.
So we've got our 3 scenarios. What did they find?
All right. Well, this is where it gets really exciting, scenarios 2 and 3, the ones with the increased preventative care.
Okay.
They demonstrated a significant return on investment when they looked at the out-of-pocket costs.
Wait, so you're saying investing in prevention actually saves money in the long run?
That's exactly what they found.
That's wild.
Yeah, and the savings were substantial, especially in scenario 3.
Okay.
So the model predicted potential savings of 5.94 billion Swiss francs for the entire population aged 35 to 100.
Wow, billions with a B.
That's right, and that's over 1,100 Swiss francs saved per person over a lifetime.
That's incredible.
Yeah, it's pretty remarkable.
Okay, so I'm starting to see the big picture, right? Billions in savings for the system, thousands for the individual patient. But, what does that look like for the average person sitting in my chair?
Yeah, that's the question, right? How do we apply this?
Yeah.
Well, for a 35-year-old individual, the model predicted savings of around 1,700 Swiss francs over their lifetime, with the preventative 2 outlined in scenario 3.
Okay.
So think about that. The extra money they might spend on those extra hygiene appointments
Right.
is more than offset by the reduced costs of treating periodontitis and all those potential secondary health problems we talked about.
Okay, so it's kind of an investment up front,
It is an
but
investment.
it pays off big time later on.
That's right.
Okay, I like it.
Yeah, so you can actually see the numbers and how it makes a difference.
So I'm a dentist listening to this. What can I actually do with this information in my practice?
That's a great question, and that's exactly what we're going to delve into next.
All right, I'm ready. Let's get practical.
So, we've talked about the potential cost savings, but how do we actually use this research to make a real difference, in our practices day to day?
Yeah, let's get practical.
All right, well, one of the biggest things that jumps out at me is, early detection and diagnosis.
Okay,
The earlier we can catch periodontal disease, the less invasive and expensive the treatment's going to be.
makes sense.
And that translates to savings for both the patient and the healthcare system as a whole.
It's like they say a stitch in time saves 9, right?
Exactly. So those periodontal probes,
Yeah.
they're not just for charting anymore.
Right?
They're a key tool for preventing, much bigger problems down the road.
I like that. I never thought of it that way. But yeah, it makes sense.
Yeah, we need to be proactive, not reactive.
For sure.
And when we're talking about early detection, we also need to be thinking about those secondary health issues that we talked about.
Right.
We need to see ourselves as partners in our patients' overall health journey,
Hmm.
not just their oral health.
That's a good point. So we're not just dentists, we're like health advocates.
Precisely. And that brings us to another really important point, which is patient communication.
Okay.
We need to be able to explain the benefits of professional periodontal care in a way that patients can understand and relate to.
So less, gingival inflammation and more like healthy gums for a healthy heart.
Exactly. We got to ditch the jargon, connect those dots for them,
Yeah.
explain how their oral health impacts their overall health and well-being.
And now, thanks to this study, we've got, even more data to back that up.
Exactly.
We can actually show patients like, look, if you invest in these extra cleanings now, you could potentially save yourself thousands of dollars down the road.
Right. It's all about framing it as an investment, not an expense.
I like that, yeah.
And this research gives us the data to back that up.
This study also talked about the importance of public awareness, right? What can we do on that front?
Well, there's a lot we can do. We can start by making sure that our own practices are promoting the message of preventative care.
Okay.
Brochures, posters, even videos in the waiting room can all help get that message across.
What about social media? I feel like that's a good way to reach a lot of people.
Absolutely. Social media is a powerful tool we can use to, share these findings with a wider audience.
Yeah.
Imagine if like every rental practice in the country was talking about, the financial and health benefits of periodontal care.
Yeah.
We could really shift the public perception of dentistry.
We could start a movement.
Exactly. And that's what we need. This isn't just a niche issue. It's a public health priority.
Hmm.
We need to be talking about this with our colleagues, with community leaders, with policymakers.
We need to be advocating for change, basically.
We need to be advocating for change. You got it both within our practices and, in the larger healthcare system.
This has really opened my eyes to how much of an impact we can have, as dentists.
Yeah.
It's not just about treating teeth and gums. It's like we're shaping the future of healthcare.
That's an exciting prospect. We have the knowledge, the tools, and now we have the evidence to back it up to really make a difference.
So what would you say is the most important thing you want dentists to take away from this research?
I think the biggest takeaway is that preventative periodontal care isn't just good medicine.
Okay.
It's smart economics. It's an investment that pays off for everybody involved, the patient, the dentist, and the healthcare system as a whole.
Well said. I really like that, this deep dive has given me a lot to think about.
Yeah, me too.
What about you? What do you think is the most important finding from this research? For me, it's that reminder that what we do as dentists has this ripple effect that goes way beyond just the dental chair.
Yeah.
We're not just treating teeth, we're impacting our patients' whole health and well-being.
Absolutely. And this research really highlights that connection,
Right.
right? That oral health is just fundamentally connected to overall health.
Yeah, all connected.
It's not a separate thing.
And I think, for a long time, dentistry has kind of been seen as this like side note
Right.
in healthcare, but this study really positions us as these key players in preventing and managing some serious chronic diseases.
Yeah, it's about time dentistry got the recognition it deserves.
No, right?
We're not just the tooth fairy anymore. We are essential healthcare providers.
We are, and this research proves it.
It does.
It shows that, investing in oral health isn't just this like feel-good idea.
Right.
It's a smart investment with real tangible returns.
Right. I think this study is going to be a game changer, honestly, for the profession.
Yeah.
It gives us the evidence we need to advocate for ourselves and our patients.
Exactly. We can go to policymakers, insurance companies, even our own patients, and be like,
Right.
here's the data.
Here's the numbers.
This is why what we do is so important.
Exactly. It's a powerful tool for changing the conversation about oral health.
For sure. And at the end of the day, that's what it's all about, right?
Yeah.
It's like shifting that paradigm, raising awareness, making preventative care a priority.
Absolutely.
Well, this has been really enlightening.
Good.
I feel like I have a whole new understanding of, how important my work is.
That's great.
And I'm feeling inspired to take action.
I love that that's what we want, with these deep dives,
Yeah.
is to give you the knowledge and the insights to make a real difference in your practice and in the lives of your patients.
Awesome. So to wrap things up for our listeners out there, what's the one key message you want them to take away today?
I would say don't underestimate the power of prevention.
Okay.
Professional periodontal care. It's not just about healthy teeth and gums.
Right.
It's an investment in overall health well-being and even financial security.
Yeah.
So share this knowledge with your patients, advocate for change, and be the catalyst for a healthier future.
I love it. Couldn't have said it better myself.
All right.
Well, that's it for this deep dive. We hope you found it as fascinating and thought-provoking as we have.
Until next time, keep seeking knowledge, keep asking questions, and keep diving deep into the world of dentistry.